Hi, welcome to Treatment Thursday. I have my volunteer here. Today our topic of conversation is acne, what you can do to help control your acne while you're at home. And right now I'm in the middle of just cleansing his face. I'm using the PBO 5% benzoyl peroxide, which is really necessary for acne-prone patients or clients. So we are going to just continue with cleaning our volunteer's face here, and then we'll proceed to our next step. Okay, so step 2, we're going to apply the toner to our volunteer's face here. We've already cleansed his face with the PBO cleanser. We're going to use a toner, air dry him, and then we're going to go ahead with a detoxifying acne mask. So we use a toner to really just take off excess any type of soap, but also clear the pores, open up his pores, so that when we do the detoxifying mask, we have full access to all of his pores, and we want to really clear out all of his impurities, pull out the blackheads, and go from there to get a good treatment, overall treatment. You can do the masks once a week if you have acne. That is actually recommended. Okay, this week I have a fan. Do you have any stinging, burning, any of that? Okay, we're good to go. Okay, step 3 is our detoxifying charcoal mask. This is recommended for acne-prone or any type of adult teenage acne period. Once a week you could use this. It will not dry out your face. It is a black charcoal and it will turn gray as it dries. You leave it on 5 to 10 minutes. And you just apply. You can use, as we mentioned before, your own fingers to do this, but since he's here, I am going ahead to apply the mask to his actually the entire face. You could just do it for spot treatment, but I prefer to do the entire face. How are you doing there?
Good.
You want to avoid the eyes and the lips and the nasal area. And as I get closer to those areas, you'll see how I'm avoiding it. But I really want to get where his concern is, which is his nose and around his mouth and lower chin. Most young adult teenage acne is hormonal, but that doesn't mean we can't help prevent the outbreaks. What we're trying to do is prevent this gentleman from having acne spread or continuing to have it in the areas that bother him. So we're trying to pretty much maintain a clear face. As you can see, it's very dark here and it's starting to lighten up around the edges. So we want to avoid the areas of the eye here, around the lower part of the nostril area, and the lips. If you do, by accident, get close to those areas, basically will start stinging, you know to just rinse it off with water right away. Don't leave it on. We're almost done here. Now this gentleman has some facial hair, which is a good thing to show and point out. Those pores can be blocked by the facial hair. I'm not recommending he shave his face if he's trying to grow a mustache or a beard, but just reminding him that he can have more areas where you'd have some outbreaks with the hair. And that's a normal occurrence. Okay, so now the mask is fully applied. We could apply it to his neck if he had any acne there, but he does not have any acne on his neck. So we're just going to let him sit here for about, I would say, between 5 to 10 minutes. Our way of knowing when to take off the mask is when it starts to get the light gray. So we'll tune back to see how he's doing. Okay, so we're back to our first volunteer, and this means the mask is ready to come off. So we're going to have him remove the mask, and we'll be back to finish up his acne treatment. Okay, we have our volunteer back. His mask is off. You can see he has a little bit of redness or rosacea, we'd say. That is a normal outcome that you'll see after a mask. It does calm down. And now we're going to finish up with what would be our customizing of the actual treatment. So what we're going to use first is our hydrating serum for moisture. Then we will follow that by our rejuvenating serum, which will help with the glow to keep the complexion and the good skin tone. And then we'll end with the moisturizer and SPF. Remember, a little goes a long way, and you just evenly apply over the entire face. Seems to be handling this well. Probably feels awkward having someone else touch his face. And that is our hydrating serum. Next will be our rejuvenating serum, again for moisture. For adult acne, really helps prevent fine lines and wrinkles. Also for the younger adult, prevention of scarring, the best we can. So we're going to apply just a little bit like we did before. People call it T-zones. I just say pretty much all the essential areas. Circular motion works, if you can remember. There's no right or wrong way of doing this applying. Just a little bit goes a long way. Try to evenly apply it on the entire face. Okay, I'm going to go ahead and apply the Clear Skin Moisturizer. Remember, Q-tip, no fingers. I'm going to put some on the back of my glove here, and then I could use my fingers. You could also apply with a Q-tip if you'd like, but for this video, we're going to use my finger. Again, the ring finger, the lightest finger. And then just evenly massage this in. Now you want to remember, with acne or any type of pimples or cystic acne, it's about giving your skin moisture, not drying it out. The more you dry it, tendency is to have more outbreaks of acne. How are you doing there?
Good.
You feel okay?
Yep.
All right. Last but not least, the Weightless Protection SPFF. We're going to apply this before we thank our volunteer for coming on in. And what we're going to do for the next 2 weeks is set him up with supplies so he can treat his face, and we'll do a return demo in 2 weeks to see how well his acne has cleared up. Always remember your sunscreen. Doesn't look like I got a convinced person here, but this is one of the best sunscreens you'll ever get. Lasts at least 2 hours. It is waterproof, and it's light, so you don't feel like you have a thick layer of gunk on your face. It really is nice. And no joke, test it with the rays. You will not get burned, especially if you're an outdoorsman, if you fish, if you're doing anything exciting outside. You won't have a sunburned face. Melanomas, skin cancer, very, very prevalent in the summertime in this neck of the woods, but also in the wintertime because of the rays that are not seen. So, there you have it. And now he is complete. We are back now with our second volunteer today. We are going to use a different type of a mask, but right now, as you see, I am continuing to do a cleanser, PBO cleanser. Just rinsing her off here. We're drying her, then we'll go ahead with our nutrient toner. Now I'm using the nutrient toner. Are you doing okay?
Mm-hmm.
Does this burn?
No.
Sting?
A little bit.
It'll sting. Okay, that's normal. It doesn't mean she's allergic. It's a normal response. So in our volunteer, we are now going to use a clarifying mask, which again is used for acne-prone clients, patients, as well as people that might, for females really, menstrual cycles tend to bring out a lot of their acne. So it's another one that you could use weekly or even during your menstrual cycle to help with redness, swelling, or any type of pustule acne. How are you doing there?
I'm doing good.
Okay, we're ready to proceed. Okay, so what you'll see me applying is a salicylic mask. It's our clarifying mask. It will be white. Now, what would be the difference of the two masks? Well, not just the color. The other has a charcoal base. This is going to be more of a salicylic mask. It could cause a little more tingling. And we leave it on only for about 5 minutes. Again, avoid your eye and your mouth and your nasal area. How are you doing there?
I'm doing good.
Okay. It's a serious business getting rid of acne. Everyone is very serious here. We're acne busters. Okay, you can laugh. It won't hurt to laugh. It's good. This time, it's really good to have some laughter. Okay, now that's how you would apply it, and we're going to leave that on for about 5 minutes. Are you okay with that?
Mm-hmm.
How do you feel?
It does sting a little bit.
Stings a little bit. Okay. So if it does tingle, sting, that's not a bad thing. That is the salicylic mask and how it works. Your face can also get a little red. That's a normal occurrence. Okay, so we are removing the clarifying mask, and our volunteer says it does cause tingling, and it is a little bit of a burning sensation. But again, that is what salicylic does. So we are going to remove it, and we'll be back once we have it all removed. Okay, so now we are back with our second volunteer who did the salicylic mask, the clarifying mask. And as you can see, she does get a rosacea. It is a stronger, you could smile, it's not so painful. It is a stronger mask, and I'm going to ask a few questions, and then we're going to finish off her actual acne treatment. This doesn't take this long at home, to be honest. We're doing the mask incorporated with your daily cleansing of your face for acne patients. So do you have any burning sensation? Are you feeling any burning?
No.
Okay. How does your face feel after that mask? How did it feel initially?
When it was put on, it did burn for a while, but then the burning went away, and now it feels pretty normal.
Okay, and that is an actual reaction you will see, and you'll experience those symptoms. It doesn't mean you're having an allergic reaction. It is a very strong mask. But again, we are showing you, demonstrating 2 different types of acne as well as 2 different types of masks. But now what we're going to do with our volunteer here is do a little bit different than our first volunteer. I'm going to actually apply a spot treatment to one area, and then I'm going to use an acne gel, which is similar to a serum, but it is for acne that is overall on the entire face or neck or décolleté or back. You can use it religiously like that as well. So we're going to go ahead and do that. If you're ready, we'll go ahead and do that. Okay. So the acne spot treatment, we're just going to apply right here. Spot treatment means you just apply it to that area that is bothering you. So I'm going to do it to a few spots, right? I'm going to do one here, and then I'm going to do like run here. I randomly am picking where she does have actually a little acne going on. Now, this volunteer actually has rosacea as well, and that's where you see the redness of the face. Very sensitive skin. There are several types of skin patterns, Fitzpatrick 1 through 6. I would say she is 1, Fitzpatrick 1, very sensitive, very light skin. Sun, sometimes lotions could be irritating to the skin. So the first thing to know is what type of skin do you have. So right now, that is the acne treatment. That is already dry. It dries very fast. Now on the gel, what we're going to do with the acne gel is very similar in the bottle to your rejuvenating serum, your total serum. We're going to apply this to her entire face, where I feel like the areas of the cheeks and the jawline and the neck. Okay? So. And this is just, again, light touch, and we just simply, circular motions, massage it into the area of the face. The one thing you want to prevent when you have acne is picking at your face, popping your pimples. Don't be pimple popper, but you want, because you'll get scarring or you'll spread the acne. So you really want to, the best you can, keep it at bay without touching your face. It's very difficult to do because no one likes to have anything on their face or to show in public. We're all very sensitive. How do you feel there?
I feel good.
Okay. Do you feel anything different?
Mm-mm.
Okay. Again, upward strokes. Okay, I'm going to give that a few moments to dry, and we'll be right back. All right, now that our client is relaxed and we've had a moment to chat, I'm going to finish up with putting on hydrating serum. Remember to provide moisture to her face. And then we're going to use our Clear Skin Moisturizer, which is designated really and intended for acne patients or clients. And then always end with your SPF of 30 or greater. Personally, I like the 45 or greater. one of our best is that sunscreen. So do get that into your regime. I always want to try to do this as I told you not to. It's always a constant reminder not to turn on the inside. Again, this will be applied, I say liberally but sparingly, to their whole neck. We don't use a lot. These containers actually last you 4 months if you use them correctly. And you just simply apply it over the acne gel, over the spot treatment. Then going on with our moisturizer. Remember a Q-tip, not your fingers. And I'll just apply that onto here. This is our moisturizer, Clear Skin. It has niacinamide in it, which helps with impurities, helps give moisture, especially for the acne areas. It is the one real moisturizer that I have to say does work well with acne. Acne patients need moisture. They don't need drying. But because it has the niacinamide in it, which is an excellent moisturizer, it helps at the cell basement membrane of the actual acne and provides moisture so that you don't have outbreaks. Really keeps it all at bay. So the goal is clear out the acne at the base of the membrane, let the collagen continue to grow and the skin to grow as it would, and replenish all of your polypeptides to your face so you don't have the outbreaks. The key to anybody with acne, whether you be 10 years of age or in your 60s, you have to wash your face, you have to use a moisturizer. That has to be done daily, morning and night. And the last step, as she's drying here, will be her get into the habit of sunscreen. Again, the sunscreen works on any types of the skins, 1 through 6. So it's not like one sunscreen for one type of skin. It's very light. It's a thin film over your face. It lasts, like I said, up to 2 hours or more. Waterproof, especially with rosacea patients, you definitely want to have sunscreen on. Foundation alone will not have enough sunscreen in it. But as you can see, as we're applying, her face is getting lighter and lighter. We don't see as much as the rosacea as we were, as the skin is calming down. We want that reaction. We want that vasoconstriction. We want those cells to be alive while we're doing these masks. That's a good reaction we had. It might have scared some of you looking at home. It might have even scared my volunteer here, but this isn't our first rodeo. There you go. Now, with this client, we will then send her home with the products and we'll see her back in 2 weeks. She will be using both the acne spot treatment and the acne gel, whereas our first volunteer will just be using the spot treatment. As we know, you males out there, little is more, so we're going to keep it with that. Have a great day.